My experience as a victim of 10 years of human tortures by inject and planting technologies to humans and using artificial intelligence and waves. The first issue, waves. If waves are classified as a whole, waves are divided into two general categories. 1. Communications waves, sender receiver. 2. Different types of waves. The second issue, how they do it. In both cases, they can't do anything to humans. 1. The first case, only with waves and without implanting microtechnologies inside the human body do anything to a human. 2. The second case, they inject microtechnologies into the body and they use waves as well, and they can do anything to humans. In this case, implanting microtechnologies, this is for greater accuracy and maneuverability. These microtechnologies are not visible to the naked eye. The third issue, how do they inject microtechnologies into the human body? They inject microtechnologies into the human body with various vaccines. These microtechnologies are the interface between biology and technology. They introduce and inject technologies into the human body. The blood stream, muscles, cartilage, nerves, brain, bones, stomach, intestines, lungs, and all parts of the body. It is not clear exactly what these microtechnologies are because they have a wide range. Some of these microtechnologies have been identified what they are. Those who have been identified: 1. Graphene oxides. They cause the body to become magnetic and magnetic. 2. In the past, when technology was older and weaker, they used microchips, nanochips, robochips, and etc. Countless other 3. Countless other unknown microtechnologies. It means the more ampoules you use, more microtechnology is likely to enter your body. It doesn't matter what this ampoule is: COVID-19 ampoule, booster ampoule, cold ampoule, serums, and all ampoules and serums. The more you inject, the greater the chance that these microtechnologies will enter your body. Next item, food and drinks. You drink any water or food, it is possible you have microtechnologies inserted and injected into your digestive tract. Regarding the respiratory system, chemtrail, which is an obvious issue, but there are other hidden and covered things that few people pay attention to. They release tiny metals or microtechnologies into the air. That these microtechnologies enter your lungs and respiratory tract, respiratory system. Another weapon, remote injections. They also have more advanced technologies that remotely introduce and injection microscopic particles into human skin. It means they inject particles into human skin. They do it from a distance. There are other ways to implant microtechnologies, such as surgery, implants placement, and etc. The fourth issue, what devices and methods do they use to broadcast both types of waves? The methods of spreading waves by them are extensive, varied, outward and covert, and numerous. Some of them that have been identified so far, they are like this. 1. Satellite 1. Satellites. 2. Telecommunications towers. 3. Power towers. 4. Portable devices, which they plant near the victim. For example, they place portable devices inside the walls of the intended victim, or they place the victim's devices in nearby houses and neighbors. 5. Internet of Things, devices that have multiple uses and they are used in the Internet of Things and countless other devices. What is the solution? There is no solution because there is no independent land and government.